So this week I am on urology. I've been on urology for the past 3 weeks. I have a 4-week rotation, and my experience here has been super awesome so far. My week is divided between clinic and surgery. So today is Monday, so I have clinic today, and then we have surgery tomorrow, and then it flips back and forth every other day. In clinic, this is the exam room that I'm in right now. We have our bed, the sink. Clinic starts at 8:45, 9, so we start seeing patients then. Right now it is 8:05. I'm here a bit early today, but we have a busy day. We only have one resident covering the clinic today and 2 med students, so I just came a bit early. Whenever patients start coming in, I'll start seeing them, get the ball rolling. So yeah, that's how it works in urology. Hopefully one of the other days when I do get to scrub in, maybe tomorrow on a surgery day, I'll be able to show you what it's like, but it's pretty similar to anesthesiology. I'm not going to be able to show you with the OR. You'll probably just see me in a gown and cap. Let's get the day started. Wednesday is another clinic day. I wasn't able to show you guys the OR day yesterday because it was really busy and I was in the OR the entire time. But today I'm back at clinic. See, the room's different. It is 10:05 right now. I'm just seeing patients. Usually clinic days are back to back with patients, super busy. We'll catch up later if I do get a lunch break. So talk to you in a bit. Another surgery day. I wasn't able to take you into the OR, and you've seen the locker room, so you don't have to see those again. But I'll talk a little bit about all the cases that we had today. We had 4 cases, which is a little more than usual. Usually we have 2 to 3 cases. But the ones we had today, they were all endoscopic, meaning you use a camera and you insert it through orifice of the body, and then the camera can see what's inside and fix anything that's wrong inside. And so because I'm in urology, the endoscopes will go through the urethra, and the first case we had today was something called a TURP, T-U-R-P. It stands for TRANS-URETHRAL resection of the prostate. And the name of the procedure kind of tells you what the procedure is. The camera goes through the urethra and it gets into the bladder, and then a little bit distal to the bladder is your prostate. And so basically the endoscope is resecting the prostate by going through the urethra. That was our first case. The second case was a kidney stone. So this patient, you can get stones anywhere from your kidneys to the ureters to the bladder. But this patient had a stone in the kidneys itself, and so it was a little bit difficult. The surgeons had to get through the calyces. Those are the little openings in the kidneys that end up attaching to the ureters. But it was a difficult view, and we didn't actually end up getting to where we needed to go. So we ended up just putting a stent to keep things open. The next case was a patient where she had a stent in her ureters. And the reason why she needed that one in the first place was because she had a history of a lot of fibroids. And fibroids are just benign growths in the uterus, and because they were so big, they were compressing on the ureters and causing obstruction. And so when there's obstruction, there's going to be a backflow of urine, and that can cause damage to the kidneys. And so this patient, she already had a stent from prior. She just came in and needed to exchange it just to make sure the stent is new, not breaking down, to prevent infections. So those are some of the reasons why we do constantly change items like Foley's. We want to change that to decrease infection, and the same reason for the stent exchange. And then the last case we had was also a TURP. So all in all, the procedures went all pretty smoothly. They ended up being relatively fast, and that's why I'm done pretty early today, given that we have 4 cases. So yeah, that was my day today. Tomorrow is another clinic day. Hey guys, I'm in clinic today. Today's Friday and we have oncology clinic, so all the patients who have cancer with the urologic system in their bladder or kidneys come here. Today is my last day in urology, which is kind of sad, but here's the clinic room here. I went to go see a patient in the surgery area, so that's why I'm wearing scrubs. I was supposed to help him walk around because he just got his bladder removed, so after surgery it's always good to make sure the patient starts moving to prevent any clots and just to help the healing process. But later on today I have my longitudinals every Friday, so gotta go to the pediatrician's office later. Done for the day, going to longitudinal.